And now it's for the sponsor. It's time for the sponsor perspective portion of our program. Boy, I'm blowing on some of this stuff, but I want to just say a big hello to our sponsor today, Neurocrine, not Neurocrine. I got that a little bit off earlier, so my apologies. But please welcome Kendra Martello, the Executive Director of Public Policy at Neurocrine Biosciences, who's in conversation with Linda Mims, board member of the Schizophrenia and Psychosis Action Alliance, and Randy Ruta, CEO of the National Health Council.
Thanks, Steve. My name is Kendra Martello, and I'm the Executive Director for Public Policy at Neurocrine Biosciences. We're a neuroscience-focused biopharmaceutical company dedicated to discovering treatments for people with serious and under-addressed disorders. Since the early days of the pandemic, we've examined how doctors and patients use telehealth to continue care and the impact of the rapid expansion of telehealth on our patients, those who are living with or at risk of developing an involuntary movement disorder known as tardive dyskinesia. Through that process, the data and information we've compiled has shown us a great deal about key measures such as access and quality of care in telehealth, and that's helped inform our perspectives. This panel today has been convened to discuss the important role of telehealth in patient care and the need for a balanced approach going forward. Today, I'm joined by Linda Mims, board member of the Schizophrenia and Psychosis Action Alliance, and Randy Ruta, CEO of the National Health Council. Their biographies can be found on the event page. Panelists, thank you for joining me today.
Thank you.
Earlier this year, we partnered with the Harris Poll to learn more about patient preference and telehealth. Specifically, we found that while people love the convenience of telehealth, they also value seeing their doctor in person. In fact, 80% of respondents said they would always pick an in-person visit over a telehealth visit. Linda, for persons with mental health conditions, telehealth presents important considerations between convenience and quality. They sometimes require or request therapy right away, and that can often be effectively done via telehealth. But when it comes to things such as diagnosing movement disorders and other conditions often associated with serious mental illness, that can't be done effectively via telehealth. Can you elaborate on this a bit more and explain how you'd recommend we strike the right balance?
Yes, people living with serious mental illnesses or serious brain disorders are already on the bottom rung of the healthcare ladder when it comes to accessing quality care. This makes it vital that future telehealth standards protect this marginalized population. While many mental health advocacy organizations seek to reduce or eliminate existing telemental health requirements, there is a strong clinical justification for retaining requirements for patients living with schizophrenia and related disorders, bipolar disorder, and major depression. So we must never sacrifice the quality of medical care for the convenience of using telemedicine. Movement disorders are hard to diagnose. Heart disease and diabetes, which are already routinely overlooked in this population and contribute to a 10 to 20 year or more shortened lifespan, those things cannot always be diagnosed or most never can on the internet. So diminished communication skills also in this patient group often lead to unreported symptoms, and providers frequently ascribe all symptoms to the person's serious brain disorder. So these facts make it imperative that strong safeguards are built into any regulations on the future use of telehealth, including periodic in-person office visits.
Randy, I'd like to get your thoughts here as well. Your organization represents a much broader set of persons beyond those living with serious mental illness. For patients with chronic conditions, sometimes there's trial and error in terms of getting the right diagnosis or even treatment. Patients may experience flare-ups, and many times their condition is well managed. From your perspective, how can telehealth and in-person care be most effectively used?
Thank you, Kendra, and great points, Linda. Telehealth is an important tool for people with chronic conditions and disabilities. And for decades, telehealth in various forms has extended the reach of clinical expertise into the home. In listening sessions that the National Health Council conducted recently, we heard very positive things about telehealth from our patient group members, specifically as it related to them being able to support their constituents through the pandemic. How could they manage their chronic conditions with telehealth being either the primary or supplemental source of their care while the pandemic threatened their ability to be out in the community? However, telehealth programs need to be structured well so that it doesn't inadvertently increase disparities and that it's flexible to address an individual's needs based on their specific condition. And that's key. It shouldn't be the only option for people seeking care. And your question is a good one in that it highlights that different patients will have different needs, and some will have different needs over the course of managing their health in concert with their conditions, so that we know it could be good for, telehealth could be good for, helping triage individuals to determine the best venue and schedule for care, in person or telehealth, for follow-up visits, for routine and maintenance visits for those whose chronic care is well managed. And telehealth could be a supplemental source of support to the clinician and the patient, but not be a substitution overall. Patients and providers need the tools to determine when the patient is best served to come in for a visit or when a visit via telehealth is appropriate. So that clinician consultation with a physician is key to understand when telehealth is the right course for that patient at that time.
Thank you. One final question for you both. We can all agree telehealth has many benefits, and as such, it's important that it remain part of our healthcare system. There are also areas, however, where it may not be the best option. What are 3 things lawmakers should consider as they weigh long-term telehealth policy? Linda, we'll start with you.
Well, lawmakers first and foremost must safeguard the highest standards of medical care when formulating regulations for the use of telehealth. The convenience of using this platform must be balanced by evidence-based outcomes. We have all seen how the exponential growth of new technologies over our lifetime have outpaced regulations to rein in inappropriate use. So healthcare is one arena where we absolutely cannot afford to let this happen. Federal and state lawmakers need to keep in mind that technology in and of itself is not the goal here, but fostering relationships between care providers and patients to achieve optimal treatment and save lives is the top objective. So telehealth is a tool, as Randy was saying, that should be used to complement, not replace, in-person care. And any laws governing its usage must be comprehensive in scope. Patchwork laws will not do it. Regulations should ensure a balance between in-person and virtual care and include these provisions. Providers must see their patients in person in designated intervals to ensure that patients receive the screening, diagnosis, and care they need. And Congress should work to maintain patient protections for those living with mental illnesses or serious brain disorders. And then comprehensive training programs for providers for the use of telehealth platforms must be mandated and help, because providers need guidance on how best to interact with people over the internet and diagnose their state of health. And then lastly, regulations must ensure that reimbursement rates for telehealth services are adequate and fair in both Medicare and private insurance coverage. And the Centers for Medicare and Medicaid need to continue reimbursement for audio-only sessions. So telehealth can be a great tool in our continuum of care toolbox as long as guardrails are built in upfront, built into the law to protect patients and providers and ensure the highest standard of care for everyone. After all, isn't that what we are all working for?
Kendra, I'll jump in. I couldn't agree with Linda more. I'll just make my 3 points succinct. So demand for telehealth is here to stay. We know that policymakers have got to work together to maintain this as an option, but as an option. We know that we can't have one-size-fits-all policy solutions because one-size-fits-all doesn't work for healthcare and the best interests of patients. So telehealth, like all aspects of healthcare, has got to be patient-centered and physician-guided and informed. We also know that money can be a real driver in healthcare. So the right incentives through payment policies need to be in place to encourage providers to invest in the needed tools that provide telehealth services, while at the same time not overly incentivizing telehealth over other areas of healthcare delivery, because again, it's got to be the patient and their needs that's determining where that venue of care occurs. And then lastly, we need to be able to allow providers to see patients that may live in states other than where that provider is located. That is the one theme that came up in every conversation with our patient groups with regard to their constituencies. Oftentimes patients who have rare conditions or challenging conditions don't have providers who are nearby. So the state and federal government absolutely should be encouraged to allow patients to access providers that are outside of where they live, the state that they live in, but that we want to make sure that that's done in a way that continues to safeguard the safety and best interests of that patient and provide against fraud and abuse. So those would be 3 points I would encourage lawmakers to examine as they look to improve and sustain telemedicine options.
Well, thank you both very much for your time and your perspectives today. While telehealth policy long-term is not currently actively under consideration, it does remain an important area for Congress and legislators to address. And so we hope that this conversation will help be part of that discussion. Thank you again, and thanks for your time today.